Okay, it's 7:01. I've started the recording. We are on chapter 2 tonight. This is 2301. Both sections, or all sections that I've got. So I've got a couple of classes mixed together here. If you see people online that you didn't think were in your class, it's because we've got two classes mixed together here. So everybody should be doing the same content, the same assignments, and all of that in both classes. Um, Give me a thumbs up if you can see the screen that I'm sharing right now. Can you see the screen? It should say, let's see, my first screen says the special education process from initial identification to the delivery of services. Everybody got that? Okay, and I will post this uh, PowerPoint to the Canvas site after class tonight, along with the recording. So if you missed something, you can go back and check. Don't feel like you have to quickly take notes on everything, but I do think it's good to jot down a few things as we go along. And if you've got questions, please ask those. Maybe go ahead and ask them out loud rather than putting them in the chat. I might not see the chat, but ask them as we go along so that we can have a little bit of discussion. I don't think we'll go as long tonight as we did last week. I think that I'll be closer to right at an hour, maybe a little bit less. Even I've got 17 slides, and that shouldn't take too terribly long to go through. So please stop me and ask questions as we go. I didn't tell you all too much information about myself last week, so I'll give you a little bit of frame of reference about me before we dive in too deeply. I am a career special educator. I was an undergraduate special ed major at Abilene Christian University long time ago. I knew that I wanted to be a special education teacher when I went into my undergrad program. And so I was an elementary education major and an all level special ed major as well. And then I began my career as a special education teacher, and I've taught all levels of special education from pre-K all the way up through high school and everything in between. So I've taught all levels of special education. And then I decided I wanted to become an educational diagnostician. And if you're in your undergrad program right now, you may not know what that position is. But an educational diagnostician is the person in the school system who tests individuals to determine if they do have a disability. And after you work in schools for a little while, you'll come into contact with diagnosticians because they're the ones who will acquaint you with the students who are in your classes who have disabilities. And even if you're a general education teacher, as I talked a little bit about last week, if you're a general educator, you will have students in your classes who do have disabilities. Everyone will have students with disabilities. And at some point, you'll be called upon to be the general education representative for that student in what we call their admission review and dismissal meeting, or their ARD committee meeting. That's what we abbreviate it in Texas. Admission review and dismissal stands for we abbreviate that with ARD. And so you'll hear people talking about ARD committee meetings. I've heard people say, I'm going to an art meeting, and they don't know that that's actually an abbreviation for ARD, A-R-D. And they just use that term so frequently in schools that people lose the meaning of it. But that's the meeting that we use to put kids in and out of special ed and to check their progress. Well, I had gone to a number of those as a special education teacher in my first few years of being an educator. And I ran into a diagnostician who did a really crummy job of explaining what I was supposed to do with her results. And I thought, well, I could do that job and I could do it a whole lot better than her. And so I decided I wanted to pursue that in a master's degree. So I went back to school and I got a master's in educational diagnosis and became a diagnostician myself. And I did that for a number of years, both in public schools and in private practice, where I tested kids in the public school setting for disabilities. And then I did that independently as well. And then after a time, I became an elementary school, an assistant principal. And then I went to work at the Education Service Center Region 11. Some of you may have heard of that. If you haven't yet, when you become teachers, you'll get acquainted with the service centers, the regional service centers. And there's one of those in every group of counties of about maybe 10 to 15, no, 10 to 15 counties. There'll be a region service center where teachers go for extra training and help. The small schools usually use those service centers a lot because they provide a lot of training and materials and things like that that perhaps the small schools don't have access to otherwise. If you find yourself in a great big urban school district like Fort Worth or Dallas or Arlington or Waco or one of the bigger school districts, even, if you are further outside of our area of Stephenville, you may find yourself in, Austin or Houston or San Antonio or further to the west, Abilene or Midland, Odessa, Lubbock, Amarillo. Some of those larger school districts do most of their training themselves, but a lot of the smaller school districts go to the service centers for training. So I worked at the Region 11 Service Center in Fort Worth for about 6 years doing training. Then I went to work for the Hearst Euless Bedford Schools as the Assistant Director of Special Ed. Then I became the Director of Special Education. And then I came to Tarleton about 9 years ago as a professor coordinating the program for educational diagnostician certification. So I teach special ed courses here and coordinate the program for diagnosticians. So I've had a wide and varied career in education, but almost exclusively in special education. I had that stint as an assistant principal, which covered general ed too, but most of my experience is in special education. So I've done a whole lot of different things in special ed, but that's where my heart lies and where most of my experience is. So I know this area of education backwards and forwards, and we'll talk a lot about that as the semester goes on. So let's dig into that. How are students with disabilities identified? And like I said, this is where I really have a lot of experience because this is what I became so interested in as a young teacher. I thought, okay, I'm getting these kids in my special education class, and how am I getting them in here? What's the deal? Who's deciding that these kids need to be in my class? Some of them seemed like they really needed my services, and some seemed like they didn't. And what was the deciding factor? Why did some children come into my special ed classroom, and why did others not? And so this tells us about that process. And chapter 2 in your textbook defines it in very succinct terms. Identification is the very first step in the special education process. Identification requires a multidisciplinary team effort, and we use lots of different tools. So let's suppose you're that general education teacher. You're not the special ed teacher down the line someday. Maybe you're the reading teacher, or maybe you're the first grade teacher, or maybe you're the PE teacher, or maybe you're the music or art teacher, or maybe you're the 5th grade science teacher. It matters not what your particular area is going to be down the line, but you're a general education teacher and you've got a student in your classroom and you can tell that something is off. Something is just not right. And you can tell by the way the student performs in your classroom that something is going on. And so what do? Well, just off the top of your head, what do you think you would do? Well, if you're not the student's homeroom teacher, you would probably talk to the homeroom teacher and say, what's going on with little Johnny here? He doesn't seem to be keeping up with the other students. He doesn't act like the other students. Maybe he doesn't even look like the other students. Now, that doesn't sound very politically correct to say, but sometimes it's exactly the cue that we get that tells us that something's going on. Maybe he just doesn't look like everybody else. He doesn't behave the way the other kids do. He doesn't act like the rest of the class. His behavior stands out. His performance stands out. Or maybe he's the kid who just blends into the background and we don't notice that he's so different. But when it comes time to grade papers, performance is just radically lower than everybody else. So something about this child stands out to you, whether it's when you grade the papers or when you're trying to manage the class with your classroom management tools and nothing's working. He's bouncing off the walls, or he's hiding under the desk, or he's acting out and being, terribly unkind to other children, or it's the little girl who cries a lot. Lots of different kinds of things may be the impetus for letting you know that something is different about this student, but something cues you that things are not right with the child. So then you would try to find out what the process is in your school. Now, this is where things get a little bit tricky because it varies from district to district, and it varies sometimes even from campus to campus within a district as to how we manage the referral process to getting a child into the special education system. We may use a variety of screening tests. We use informal and formal instruments to determine whether or not a child qualifies for special education. And so we'll talk about some of that as we go along. Now, we talked last week about all of the different types of disabilities that serve as those criteria categories. And remember, there were 13. We're going to review them here in a few minutes, but there are 13. And among those 13, some are very severe, significantly disabling conditions, while others are rather mild. Some we see right off the bat that the child is very different from their peers, and others are what we would consider to be invisible disabilities. So those more significant disabilities that are severe are usually identified very early on by physicians or parents. So those students usually have a label of disability before they ever get to school. Those are going to be our disabilities that are more significant, more severe cases of visual impairments or auditory impairments or traumatic brain injuries or more significant intellectual disabilities or orthopedic impairments. Those kinds of things are noted long before the child ever gets to school. And so those children usually come to you with a label, and you're going to be notified of that before you begin your first day of teaching. The school counselor or the principal or the previous teacher, somebody will let you know you've got this many children in your class who have disabilities, and how you're going to handle those. These children, will only be in your class for part of the day. These children will be in your class with some assistance. Those children who have already been labeled with more severe disabilities. It's also good to note that all infants and toddlers and preschool children who have a disability or are at risk for developing a disability are entitled to special education services. And we'll talk about that a little bit more later in the presentation, what we do about our preschoolers who have disabilities. But what about those students with mild disabilities? Those are usually identified after starting school, when teachers determine that they are significantly behind their peers in academics or behavior or other areas of socialization, things like that we notice. So you would find out what the procedure is in your school. Usually it goes through our school counselor. Sometimes it goes through an assistant principal. Sometimes there is a coordinator on your campus. If your campus is very large, there might be a coordinator who puts all this kind of data together and manages all of your pre-referral situations that you have. Sometimes we call that person an RTI coordinator, and that stands for response to intervention. And we'll talk about that here in a minute too. We have a slide that's devoted to response to intervention. But you would want to know what the pre-referral process is on your campus. And then that pre-referral coordinator, and like I say, oftentimes it's the school counselor or an assistant principal if there's more than one assistant principal. And that person would tell you what data you need to gather. Because what what used to fly many years ago when I was in the early stages of my career, but doesn't fly anymore. And that would be a statement like this to your referral coordinator. There's a child in my class that just can't do anything, just can't keep up with other people. And that would constitute a referral. And that doesn't work anymore. What constitutes a referral now is a lot of very detailed data about exactly what it is the child can and cannot do. So for a referral now, when we talk about gathering data, we need specifics. So where's the problem? Is it a math problem? Is it a reading problem? If it's a reading problem, what kind of reading problem? Is it a decoding problem? Is it a comprehension problem? Is it a fluency problem? Is it a phonics problem? If it's maybe it's a an auditory issue. Is it the child's not listening? Is it that the child doesn't have verbal output? Is it that is it a behavioral issue? Is it that the child is overly active with their behavior? Is it that they shut down and close in? How does that affect their academics? And then what area of academics are being affected? So a referral these days has to be very specific in the areas that are being impacted and in what ways are they being impacted. So if you suspect a child of having a disability, you're going to have some data, and your data needs to be specific. Then the next bullet that you'll see is pre-referral intervention. Before we ever move forward with special education referral, we want to know that a lot of things have been done first, because special education should be a last resort rather than a first resort. We don't want to be putting children into special education until we've exhausted all of our other possible remedies for what's going on. So, have we changed the child's seat in the class? Have we tried other non-special ed types of interventions? Have we tried a different type of approach? If we've been using an auditory approach, have we tried a visual approach? Have we tried some peer tutoring? Have we tried some after school programs? Have we, what all have we tried with this student? And we want to be specific with those techniques that we've tried. And are they research based, or are we just, pulling them out of our hat? And then here, the last bullet that you'll see is response to intervention may be used. And like I said, we've got a slide that's devoted to response to intervention here in just a second, and I'll talk about that more specifically when we get there. So what assessment techniques might be utilized? Well, sometimes we begin with some observation of the student, and the school counselor might come in, another teacher might come in, the assistant principal or principal, or sometimes even the diagnostician might come in to take a look at the student to get some data to help direct any referral that might move forward. So we want to observe in a variety of settings. Is the child just having difficulty in your classroom, or are they also having difficulty in maybe another teacher's classroom, difficulty in the lunchroom, difficulty outside on the playground, difficulty when they go to PE or to their special classes, other activities around the school? We usually send a form home to find out from the parents if they're seeing any kinds of similar behaviors in the home setting. If we're doing an observation, let's say it's for some sort of behavior, we would look for the frequency of that behavior. How often is that behavior occurring? Is it occurring repeatedly, and like I said, in multiple settings? What's the duration of that behavior? How long does it occur? The latency of that behavior. What are the periods during which it does not occur? And how long are those periods of latency? And then we would also look for any anecdotal information along the way. Perhaps the child has some peculiarities that they do off and on, and we would just jot those kinds of things down. and make note of that, because all of that information is going to feed into our overall impressions of the child when we start to make some formal decisions about the student. So then we get to looking at more formalized instruments. We do some formal testing. Your book talks about different types of instruments that we use, and one is criterion reference tests. And I will tell you that they're on your first unit test that will be after we finish chapters 1, 2, and 3. So it'll be in another week or so. There is a question or two about criterion reference tests versus curriculum-based assessments. So pay attention to this part. A criterion reference test focuses on the student's mastery of content. So make sure you go back to your book and read this section very carefully. A criterion reference test is sometimes teacher developed, sometimes it's commercially produced. It identifies a skill and whether or not the student can complete that skill. And that's the criterion by which the student is being measured. Whether or not the student can master this particular criteria that they're being measured upon. The one big difference here is that the test is not what we call norm referenced. A norm referenced instrument is what I use when I measure a student's intelligence, an IQ test. And if we were having this class face to face, I would bring in one of my IQ tests that I use when I'm testing a student for an intellectual disability or a learning disability, and I would demonstrate a few of those questions with you. It's always a fun thing to pull out an IQ test and demonstrate it with the class. I also like to say at this point that, and I can't really do it very well when y'all are all online and I don't get a chance to talk to you. If you were face-to-face in class with me, we would have already had some conversation. I would have walked around the room and I would have gotten each of you to say a few things. And I would insist upon some feedback in class. I usually go around and I take everybody's picture on the first day of class. And I ask you where you're from and where you went to high school and what your major is and those kind of things, very much like we did in our first discussion board. And so I talk to you for a few minutes each. And so I get to know you just a little bit. And then I usually tell everybody that I know a little bit about your IQ already, and I can pinpoint your IQ within a reasonable number of points. And everybody gets this, big eye-opening look on their face. And I said, well, I can do that with some confidence because I've been testing IQ for about 30 years now. And they just look stunned. And I draw a bell curve on the board. And the bell curve, some of you are probably very familiar with the bell curve, and some of you not so much, but the bell curve is shaped, like a bell, and then it tapers out at the end. And right in the middle of that bell curve is an IQ of 100. And then on either side, it goes down. Now over here on the low side, I'm guessing that this is the low side when you're looking at me, I'm not sure. Is this the low side over here? And this is the high side? And when you're looking at me, is this the low side and this is the high side? Can anybody give me a yes or no? Is this the low side?
Yes, ma'am.
Okay, thanks. So this is the low side and this is the high side. And my nose is 100, okay? So by virtue of the fact that you are in college, you have passed your SATs, your ACTs at such a degree that you could enter Tarleton State University, and you are in your second year, most likely. Everybody's probably at least a sophomore, or you're in your second semester of your freshman year with advanced hours. I think you have to have at least 30 hours to get in this this course, or you should have. Or you maybe have have more hours than that. Maybe you've got junior hours. I think we even have maybe one senior or two in this class. So by virtue of the fact that you're still enrolled in college with that many hours, I know that your IQ is at least 100, and more likely it's at least 105. And chances are it's a little bit higher than that. Now, you can go on from this class with confidence that you have at least an IQ of 105. Okay, so you're above average, or you wouldn't be here. Now, if you go on to graduate school, I can pretty much tell you that your IQ is going to be 110 to 115 or above, or you wouldn't be able to get into graduate school. And then we go on from there, because a smaller and smaller percentage of the population is successful at each next level of school. So all that to say that when I give a norm reference test, it's based upon a comparison, not with a criteria, but with other people. That's what the SAT is. That's what the GRE is. That's what an IQ test is. It's a test not against a criteria, but against another group of the population. So how do you rate when compared with other high school seniors when taking the SAT? How do you compare with other people headed to graduate school when you take the GRE? How do you compare with other people your exact age when you take an IQ test? That's what a norm reference test is. How are you scoring against the norm, the normative population in whatever group we decide to compare you with? And that's different from a criterion reference test, when we have a set criteria and we're going to measure everybody against that criteria. All right, now a curriculum-based assessment. This is a measure of a student's achievement level in terms of the expected curricular outcomes of the school. This is where we're measuring against a particular curriculum. Teachers evaluate skill acquisition based on the curriculum being used. So make sure you go back to your textbook and read the section on criterion-based versus curriculum-based, because to me, those are the two that are easily confused. A norm reference test is not as easily confused with curriculum-based and criterion referenced. Those two are the two that are hard to tell apart. Okay. So error analysis is something else you want to be familiar with and use as a teacher, because it can help you very much when you start looking at kids that you think might have disabilities in your class. It can help you tell the difference between minor kinds of disabilities and more significant ones. So when we're looking at error analysis, and I'm going to give you an example here in a second, teachers should always analyze what types of errors a student makes to determine a pattern to help remediate. And error analysis also helps provide information on how to teach. Now, I think your textbook has a couple of examples of this, so I want you to make sure and look at them. There is a question about this on our exam also, but error analysis is where you as a teacher have a test, or maybe even it's just an assignment that you've given your students, and you go back and you look to see the errors that the student makes, and then how they made the error. What was the type of error that they made? And the easiest examples to give have to do with math. So let's say that the student is doing multi-digit addition, and you look carefully at the problem and you see that they haven't done any regrouping. And so you look at more than one problem and you see that this is a consistent pattern, that they've done all the patterns on the homework, all the problems on the homework, and they haven't done the regrouping on any of the problems. So this is kind of a no-brainer. You as the teacher can tell okay, we've got a problem with regrouping, and the problem is that the student doesn't know how to execute that process. So you've used error analysis to determine what the issue is, and that provides you with information on how to reteach the child what's going on with multi-digit addition. Regrouping is the issue, and you need to reteach regrouping. And then you just need to find, maybe they just didn't catch it the first time. Maybe they were absent the day you did that lesson. All kinds of things may be going on. The very best way that you can get more information then is to pull the student aside and say, okay, show me how you did this problem. And then they walk you through it. And maybe through the process of telling you how they did the problem, you see where the issue is. And then you work to correct that and give them some more opportunity for practice and make sure that they've corrected their understanding of it. And then you move on. But that's just a very rudimentary example of error analysis. And of course, you can do that with reading as well, through oral reading at the lower levels. It gets more complicated as kids get older, and the tasks that we're asking them to do are more complicated. Sometimes it takes, really drilling down to a distinct level to tell where a problem is. I'm thinking now about science experiments and things like that, if we want to see where errors are occurring. But at the elementary level, this can be pretty basic and pretty simple to find where errors are occurring. Any questions so far? We're about halfway through. Okay, the next one is a think aloud strategy, and this is very much what I just mentioned with the task analysis. It's a strategy that the student uses to talk his or her way through a solution to a problem, and the teacher can determine if the student's thought process when solving a problem is correct or incorrect. So when you get the child or the student to walk you through how they're solving something, you can see where the errors are occurring. So let's talk a little bit about RTI. RTI stands for response to intervention. And this term was coined about, well, it's coming up on about 20 years ago now, by the folks at Vanderbilt University in Tennessee. And at the School of Education there, they began talking about ways to deal with a lack of achievement. And it began with a lack of achievement in reading, and then it expanded to math and other areas, and then even into behavior. But if a child was having difficulty with reading, what we were doing is, according to the folks at Vanderbilt who did some research on this, was we were waiting for kids to fail. And when they failed, we were referring them to special education. And they said, rather than waiting for kids to fail, let's respond to them early on in the process and intervene in order for them to be more successful. So some people have said, well, this is just using a different set of words for the same thing. And you could make a case for that, but hopefully what we're doing is actually being proactive and looking for ways to help kids sooner than later, and hopefully not placing as many students in the special ed pipeline and keeping them in general ed instead. So RTI is a general education initiative. So let's say we've got a classroom full of students, and this works on a pyramid model. We're in a general education classroom, and let's just take reading as an example. Let's say we're maybe in a first grade classroom, and we're teaching reading, and we've got a group of, let's say 2/3 of the kids get it the first time around, and another third of the kids don't get it. And so the 2/3 of the kids that get it, we're going to go ahead and take them into the next level of the curriculum. And the third of the kids who don't get it, we're going to take them and put them up a level onto tier 1, the first level of responding to intervention. We're going to put them into that first tier of intervention. And so that whole group of tier 1 students will get a level of intervention that's more than the rest of the kids need, but it's not terribly invasive. And it's not something that we're going to do every single day. We're going to do it maybe a couple of times a week for maybe 30 minutes twice a week. And then a good many of those kids out of that 1/3 that we're addressing are going to get it. Because most of the kids would respond to tier 1 intervention. And so everybody that responds to tier 1 intervention will go back in with their general ed peers that got it the first time, go back into the big group. But then there's this section of kids that didn't get it with tier 1. And so that's a smaller group of that 1/3. So we'll move them to tier 2 interventions. Now, tier 2 interventions, we're going up the pyramid. Tier 2 interventions happen more frequently and with greater intensity. And so we'll probably do these 3 days a week for maybe 45 minutes to an hour. So we're up in the game. We're going to give more attention, more intensity to the kids who didn't get it the second time with a more rigorous intervention that we gave in tier 1. Now, remember, this is going to be a smaller group because a good many of the kids got it with tier 1. So this tier 2 intervention is going to happen with more intensity. Now, here's where we get a little bit of a difference. With the kids who don't get it with tier 2, we should be talking about a very, very small number. And we're going to put those kids into tier 3. Tier 3 is even more intense. We're going to do another intervention more frequently with more intensity. Now, some school districts say tier 3 is a special education referral. Some school districts say tier 3 is just another intervention, and we don't do special ed referral until we're through with tier 3. And that's just a difference in philosophy between school districts. So some school districts, tier 3 is a special ed referral. Others, that happens after tier 3. So that just depends on where you find yourself. But I don't think there's a district in Texas right now, or maybe very many across the country, who don't have some sort of RTI in place. It's pretty much an expectation across the state in Texas. When you set foot in a district on your first day of employment down the line, if you say, tell me about your RTI, somebody will tell you about RTI. And you can just use the acronym and everybody should know it. If you say RTI and they say, what are you talking about? Then you don't want to work there because that's someplace that is super out of the loop. RTI is a given in Texas schools. So that's even a good question to ask in an interview when they ask you, so do you have any questions for us? You say, sure, tell me about your RTI program. And then somebody will think you're smart and start telling you all about their RTI. So RTI is, as we see here on the screen, a response to intervention model. It's school-wide. It's this screening and decision-making model that helps us decide, okay, who needs something more than we've given them already? Who's not being successful? Who is? When have we given them enough intervention that they can go back in with their general ed peers who got it the first time or the second time or the third time? Students move through these different tiers of increasingly intense interventions. And it can be one approach to screening and identification of learning disabilities. Now, we talked last week about IDEA is our law that mandates what we do for special education from the federal level. IDEA does say that we can use RTI as a method for identifying kids with learning disabilities. But I don't know of any district in Texas at all that uses RTI as a methodology for identifying learning disabilities. And I've polled a lot of districts, and I don't know any that use it for that purpose. Now, every now and then, if there's a very strange case, a district might use it occasionally, but it is not a standard, because if you used this methodology for identifying kids with learning disabilities every time, you'd have a lot of kids being identified with learning disabilities. And so districts just aren't willing to use it across the board. They use other methods, which we'll talk about. But this is not widely accepted as a method for identification of learning disabilities, even though it's legally allowable. Okay, so how is eligibility for special education services determined? Well, first of all, it depends on the disability. It depends completely on the disability. And as we go through all of the disabilities this semester, we'll talk about how each one is determined. But you do need to know this: only students who meet eligibility criteria for one or more of those disabilities we talked about last week can they be considered for special education services under IDEA. Students cannot be considered to have a disability if there is any lack of appropriate instruction in reading or math, or if they have limited English proficiency. Now, I think that's actually poorly written there at the end. You can have limited English proficiency and still be considered to have a disability. That just can't be the primary reason. So, can we have kids who are LEP in special ed? Sure, we can. But that can't be the primary reason for their disability. So we have to rule out their limited English proficiency status as being the primary reason for their disability. Now, we do have to say that a student is not disabled because of a lack of appropriate instruction in reading or math. Now, that is going to be a huge deal this year when we have so many kids who have been out of school because of COVID. And they'll come back to school and teachers will start making special education referrals. And this will come up again and again. Referral teams will say, there has been a lack of appropriate instruction in reading or math, because we've got a lot of families that are keeping kids home and are doing instruction themselves. And we know moms and dads are going to work and kids are sitting at computers. My husband is a 7th grade English teacher in Benbrook outside of Fort Worth. And he's got some kids that sign on every day while mom and dad are at work, and they never turn on their camera. They never turn in any assignments. He never sees a face. He never has any interaction. Do you think they're getting appropriate instruction in English? No, because I don't think they're present on the other side of that camera. So if a special education referral turns up at the end of the year, the teachers can't say appropriate instruction took place. So we have to rule that out as the cause of the disability. I've seen this several times with kids who come back into school after having been homeschooled. Now, some homeschooling is excellent. Some of the best instruction I've seen is from homeschool situations, but not all of them are great. Some of them are poor. And I tested a student myself a number of years ago who was referred for a disability. And then I interviewed the mom, who was supposedly the teacher, and she needed a special ed referral. So there was no way she was giving appropriate instruction in reading and math. And it was very evident from her children who had not received what they needed. So there was not a disability in the child, it was a lack of instruction. So let's review real quickly those disability categories that we looked at last week. We've got autism, deaf blindness, non-categorical early childhood, that's what that EC stands for, emotional disturbance, auditory impairment, intellectual disability, multiple disabilities, other health impairment. Remember, that's where ADD and ADHD fall. Orthopedic impairment, specific learning disability, speech or language impairment, traumatic brain injury, and visual impairment. And that's our 13 in Texas. So what are some common evaluation procedures that we do use? Well, as I mentioned before, we often do intelligence testing, or as you might call it, IQ testing, where we test an individual to see if they're functioning cognitively where we would expect them to function when compared with their same age peers. So that is a normed reference test. We're comparing a person with other people who are their same age. And we would expect their intelligence to be within a range of what we would call normal. Sometimes we give developmental assessments. Oftentimes we give achievement assessments to see if a person is functioning at the level we would expect for their grade level in academic areas like reading, math, written language, oral language, both listening and expressive. We sometimes give behavioral assessments to see if a student is socially and emotionally where we would expect them to be. So these are all formalized kinds of evaluations. So what is an individualized education program? And we call that an IEP. Now that's an abbreviation that you'll need to know. Once you get into schools, you'll hear lots of people talk about a student's IEP. And that's the educational plan for a student that's written by a multidisciplinary team, which includes these people: parents, at least one general education teacher, and oftentimes that will be you, at least one special education teacher, a representative of the local education agency, so that's usually an assistant principal, a principal, sometimes a school counselor, and the student if the student is old enough, and if they're mature enough and able. And what are the components of an IEP? Well, the first thing that we look at are the student's present levels of academic achievement and functional performance. And you'll hear people in schools abbreviate this term, and they call it PLAFs, or present levels. And you'll hear somebody say, have you looked at the student's PLAFs? Well, that's not a word. That's just an acronym for the student's present levels of performance. How are they achieving right now? What can they do? Can they do math at the 5th grade level? Can they read at a 3rd grade level? What is their behavior like? Can they tie their shoes? Can they go to the bathroom by themselves? Can they feed themselves? Some of these kinds of things. What are their goals going to be? What are we looking at for them for the upcoming academic year? How are we going to monitor or measure their progress and report it to their parents? What kind of related services do they need? Do they need special transportation to school? Do they need occupational or physical therapy? Do they need any other kinds of supports? Do they need hearing aids? Do they need a service animal? Do they need any of these other kinds of specialized supports or aids at school? How are they going to participate in the general education curriculum? Are they going to be in general ed most of the day? What kind of accommodations are we giving them for testing? Are they going to get extended time? Are they going to get to take their test by themselves? Are they going to have things read to them? When are we going to start the services? When are we going to end the services? How are we going to transition them into adulthood? And how are we going to make sure that their parents know that their rights will transfer over to them when they turn 18, over to the individual student? Now, here's what we do for infants and toddlers. We do what is called an individualized family service plan. So if a child is under the age of 3, we do this. We make an individualized family service plan, and it's developed for these young children. It's very similar to an IEP, but it includes areas like this. Instead of what we just looked at, it includes physical development, cognitive development. Now, cognitive is thinking. That's our IQ. Communication development, social or emotional development, and our adaptive development. Are we progressing at the rate of our peers? Now, what is the least restrictive environment? Students with disabilities should be educated with students without disabilities to the maximum extent appropriate. Now, we talked about this a little bit last week about the topic of inclusion. And I mentioned this because many of you have heard of inclusion. You'll step into schools when you become graduates, and you'll hear the word inclusion a lot. And you need to know that inclusion itself is not mandated by IDEA. There is a continuum of services that we've got to consider anytime we're placing a student into a special education setting. And we want to place them in the least restrictive environment, or LRE. You'll hear people use this term LRE like it's a word. And LRE just stands for the least restrictive environment that's appropriate for that student. And so that could be a general education setting all day. So if you're going to be the general education 3rd grade teacher, that could mean that the child who has Down syndrome and an intellectual disability and a lot of things that go with that, that child could be in your classroom all day long. Or that child could be in a general ed setting with some assistance. Maybe there's a special education aide that comes in, or maybe a special education teacher comes in part of the day and helps and then goes back to special ed. It could mean that the child is in your room part of the day and then in a resource room part of the day. It could mean a special ed classroom within the regular school. So maybe that child spends all or most of the day in a special education classroom. It could mean that there's a special school within the district and the child spends the whole day at a special school. Maybe the child has other things going on and they need to be homebound or in a hospital situation. Or they might even need to be in a residential facility where they spend the nights there. They live in another setting. And so any place along that continuum might be the most appropriate setting, and that would make it the least restrictive environment. So sometimes the least restrictive environment is very restrictive, and it just depends on the particular child and their situation. So when you find yourself a member of an ARD committee, you've got to be able to help make that decision. So here's our last slide for this presentation, and I want you to think about this a little bit before we close. The answer to the question, why special education? What can special education do for a student with a mild disability that can't be done in a traditional classroom? Why would we opt for special education? Any opinions?
I can say for me, since I have experience with working with people with disabilities, I can say the reason why it's opt out is because in a traditional classroom, the teachers won't have as much patience or time to really focus on those students how they would need to, versus being where they can get all the focus, all the attention, all the practice they need with no pressure or anything like that. So, yeah.
That's a good point. Good point, Destiny. Thank you. Anybody else?
To go with what Destiny was saying, I also kind of see as like, because my little brother, he has special needs, and so I see that with what he does between a normal classroom, as you would say, or a special education classroom, is that they get the help that they actually need in a special education classroom, because those teachers have like the background knowledge more of what they can do for them, whereas a general education teacher can only do so much.
A good point, Macy. Anybody else? Okay. Any other thoughts or opinions or questions or comments? Anything? And if not, I'm going to say goodbye. Anybody?